absolutely important that we put pressure, because this is a global pandemic. It's a global threat that requires a global thrust to counter it. And patents cannot stand in the way of an efficient and equitable global response. Therefore, we have to make sure that the India-South Africa proposal gets a favorable consideration. Of course, the newly elected head of the World Trade Organization says there's another way out, that the manufacturers from high-income countries can license producers in low-income countries for manufacturing. That is being done anyway right now, but we at least should look at how best it can be increased in terms of ease and efficiency, and see that manufacturing capacity in low and middle income countries can be utilized optimally for the global response. But I believe even the patents issue should still be on the table. So we must recognize that we have seen vaccine nationalism in very many ways, even when there is an unprecedented global threat which has not been seen for a century. We are seeing vaccine nationalism in production. We are seeing vaccine nationalism in purchase, where high-income countries are cornering stocks much more than they need. We are seeing vaccine nationalism in supply chain restrictions. And we need to overcome all of these if we have to use Indian capacity or capacity elsewhere in the world for manufacture of vaccines and their adequate supply into the global supply chain. We must recognize that countries cannot be cocooned, and they still expect that they will remain safe, because no country will be safe till every country is safe. We must recognize that while the impetus for global health came in the last century from a sense of shared vulnerability because of the SARS pandemic, as well as the threat of global bioterrorism, the momentum for global health must be created in this century by shared values of global solidarity, of universal health coverage. And the COVID-19 pandemic is a very good time to demonstrate that. And the unfettered production and supply of vaccines to all who need it across the world should be absolutely important.